Joining us now, Dr. Bernard Ashby, Miami cardiologist and Florida State lead for the Committee to Protect Healthcare. Dr. Ashby, always good to see you. Thanks so much for joining us again. It's so crazy how this has become so politicized. Give our viewers some more insight into what's happening in Florida right now.
Good morning and pleasure to be here. So currently Florida is, as you said, the epicenter of the pandemic in the United States. We have 15,000 plus patients in the hospital, over 3,000 patients in the ICU. We are number one in per capita hospitalization for pediatrics, and schools are just starting. So on Tuesday, some of our counties started school, and come next week, most school districts will be in full swing. And that's obviously an ominous sign with the Delta variant in full display, and tons of people getting infected, and unfortunately, many of those are ending up hospitalized and in the ICU.
What is the hospital situation right now in Florida? We've heard a lot of different reports out there that the federal government has sent more ventilators to the state of Florida, something that Governor DeSantis is denying. What's the status of what's happening in hospitals right now? Are they at capacity right now? Are they approaching capacity?
So it's interesting. Florida has actually a relatively large hospital capacity, a relatively good nurse-to-patient ratio. So we're better off than most states when it comes to our foundational capacity. However, as you mentioned, the federal government has sent in ventilators. And it's interesting because I just mentioned that we have a great capacity, but we don't have any coordination, meaning that certain counties are overwhelmed while other counties are seeing patients, but not nearly at the capacity as of other places. So currently our ICUs are roughly at 90% capacity. And if we had some coordination, we could find a way to maximize that. But because there, again, is no coordination, we've had to, ask the federal government for help and get some ventilators and high flow oxygen units in place so that, we can accommodate all of our patients.
Let's talk about the Delta variant here for a moment, because we know children under the age of 12 are still not able to be vaccinated yet. But we know the Delta variant does not see age whatsoever. It's infecting everybody at every stage, at every age. How concerned are you about the school year, as you mentioned, already starting in Florida and the Delta variant already surging and the governor not even wanting to impose a mask rule for any of the state whatsoever? How concerned does that make you as a cardiologist who looks at people's health when you see that stuff?
So a couple of points. One, the equation has changed with the Delta variant. It produces a viral load that's 1,000 times higher than the original version of the coronavirus. Therefore, when people do get infected, they're much more likely to get sick and sicker. What most people don't realize is that it's not only getting exposed to the virus, but how much of the virus are you exposed to at the time when you're first infected. And that's why we're seeing an increased rate of breakthrough infections. Masks decrease the amount of virus that is spread. And so masks are fundamental mitigation tools. Another issue that's not being discussed enough is the surge in RSV, which is particularly detrimental to younger children, particularly infants and children under the age of 5, all of which are not eligible for vaccination. Not eligible for COVID-19 vaccination. And therefore, if you have co-infection with with RSV and SARS coronavirus 2, they're likely to get much more sicker. And we see strep throat. So we kind of have a storm of different pathogens that are really a threat to our pediatric population. And again, masks are a fundamental tool. And we have a governor who is just playing politics and really doesn't care about the science at this point, and really making it difficult for us as medical professionals, but particularly teachers and staff who are trying to protect their students. And by every account, he's making it much worse than it needs to be.
Well, to that note, I mean, Governor DeSantis is saying here that parents should be the ones to decide whether or not children should be wearing masks or not in school, which has probably led to more confusion for parents on what exactly to do to protect their kids. So as a medical professional, Dr. Ashby, what advice would you give to parents right now who might be confused on what to do right now?
Excellent. So first of all, what Governor DeSantis doesn't understand, or probably does understand, just ignores, is that mask use is a public health measure. So it's not just protecting you, it's protecting others. So masks as a public health tool is used to prevent the spread of disease. The general types of masks that the CDC recommends don't necessarily completely protect you against getting the virus, although it does have some protective effects. The CDC also recommends against using N95s. I actually would like to respectfully disagree. N95s are not in short supply. There's plenty of N95s to go around, or N95 equivalents. And so if you are concerned that your child is high risk or vulnerable, there's no reason why you shouldn't be able to have that child use an N95. And it would be great also if schools provided masks for our students as well. If students come in and they forget their masks, or they have a cloth mask that maybe hasn't been washed, which is also an issue, we should be able to have a supply of masks to give to these students. And so, yes, if you want your child to wear a mask, there's nothing stopping you from doing that. However, the best way to fundamentally protect everyone is for everyone to be wearing a mask indoors. And so, the people who are anti-maskers are always quick to point that out, but they forget that as a public health measure, masks are intended for the protection of others, which is a message that gets lost in a lot of the political rhetoric.
Yeah, Dr. Ashby, always appreciate you coming on and providing your insights on all of this. He is a Miami cardiologist and Florida State lead for the Committee to Protect Healthcare.